Hello and good afternoon. I'm not from Gloucester, and as you can see, I'm not a police chief either. But I am happy to be here, and it's important that I'm here. My name is Caleb Alexander, and I'm a practicing doctor. And as a doctor, we can be part of the problem or part of the solution. So I have a clinic at Johns Hopkins, and I'm a prescription drug researcher there at the Bloomberg School of Public Health, where I co-direct the Johns Hopkins Center for Drug Safety and Effectiveness. So as a doctor and as a researcher and as a friend, I've seen the toll that this epidemic can take, and that the toll that America's addiction to painkillers has taken, and that many of you know all too well. So you don't have to go far to find someone that's been touched by this epidemic. And from New York to LA, Portland, Oregon, and Portland, Maine, and everywhere in between. And you've heard the staggering statistics. It's bonkers that the United States could account for 5% of the world's population and 80% of all opioids consumed. So how did we get to a place where high school students report that prescription drugs are second only to marijuana in terms of ease of access, and that our top-selling drug year after year after year is Vicodin? So I can assure you that thanks to your own efforts in your local communities, a growing number of professionals are aware of just how dangerous opioids can be. You've heard from some other speakers, and I don't disagree that there's a lot more physician and prescriber education to do, a lot more. But I do think that clinicians are increasingly aware that for far too long we've overestimated the safety of these drugs and we've underestimated their risks. We've overestimated the effectiveness, we've underestimated the risks of the products. But we're not, as clinicians and prescribers, we're not the only ones in a position to do something. And the reason we're here is about the federal government, about the Food and Drug Administration, the Center for Medicare and Medicaid Services, the Veterans Administration. And as you've heard, to be clear, during the past year, we have seen some action. We have seen some change within federal agencies. You've heard about President Obama acknowledging the scope of the epidemic just this past week. Secretary Burrell just this past week proposing new regulations to allow doctors to treat more patients with opioid addiction. These are welcome events, but we need action, and we need action now. Rapid, coordinated, and comprehensive reform of federal policies from a government that's taken far too long to respond to this epidemic. You know the facts. We had an epidemic 10 years ago. And even in the past few years, while opioid deaths may have leveled, there's no evidence of substantial decline. Heroin deaths are skyrocketing. We continue to lose more than 16,000 people a year from these pills, and the drugs continue to injure hundreds of thousands more. So our federal government's here to serve the people, and when it comes to this, which is one of the greatest public health challenges of our time, we need the government to incentivize states to make more effective and widespread use of electronic prescribing and prescription drug monitoring programs. We need the government to allocate more funding for evidence-based treatment and prevention programs. We need the federal government to allocate more funding to ensure that public and private health insurers and the Veterans Administration adequately reimburse for evidence-based addiction treatment services. We need rapid and forceful and coordinated change that's long overdue. When I talk about this topic, I'd like to mention other examples of public health victories, because we have had them in this country. If you think about one of the best examples during the past 100 years, it's been motor vehicle safety. We've had a startling reduction in the number of deaths from motor vehicles. This was achieved through coordinated, comprehensive federal action. But these types of victories can't occur without that. So on the part of those of us that are on the front lines prescribing, I thank you for your attention. Thank you for being here. It's your personal stories that really motivate us and make us fed up and make us here today. Thank you.